So this is the final graphic talking about really gravity, because the aging process, to me, to make it very simple, is divided into three classifications or three categories. One is skin aging, which we've done extensive discussion on this week. Second is volume loss, which you've also had extensive discussion on in terms of how I deal with volume loss, how I don't deal with volume loss. And the third component is going to be gravity. So gravity has to do with actual elevation. And unfortunately, a lot of people try to side skirt this and try to do Ulthera, they try to do some kind of microneedle, a thread lift, and those things simply do not work. And they just create a lot of subcutaneous scar tissue that doesn't solve the problem. So I tell my patients, look, if you want some changes to your neck, either do the facelift or wait. There's no in between. I wish there was something that I could say, you know what, until we get there, why don't we go ahead and do this? And there really isn't. The only thing I get that is very early is if someone has a very early banding, I'm going to do a little bit of Botox to limit that platysmal descent, to sort of reverse it. And the second thing is jowl camouflage by putting a little filler to make it look a little better for someone that says, I'm not ready for a facelift. But if you're looking for laser tightening, you're looking for anything else, or you're thinking a filler will somehow pull your face up, it simply does not do that. So when you're looking for an elevation of the lower face, you really need a facelift or a face and neck lift. So why is it called a facelift? When I'm dealing with the neck, it's just a term that we use. And so what you're seeing highlighted in green is the area that's elevated. It's the mid face, it's the lower face, and it's the neck. Although the crease may not be entirely corrected, part of it that's gravitational will be impacted. You can see this. There's the impact of the area. The fold is improved in the middle image, but there's also parts of that fold that are not improved. So that part does, in my opinion, need a static dynamic filler. Look at that part of my video series that goes into much more detail of an African-American lady I show the results on. But in this case, gravity is something that is addressed through a face and neck lift. And so there's really two components of face and neck lift. I can spend hours talking about it, but I'll try to give it a quick summary of it. There's a deep plane facelift and there's a deep neck lift. And I perform both of those. And in the aging face, it's almost always a standard deep plane facelift with a standard neck lift. That's one component procedure. And sometimes I'll switch out the neck lift for a deep neck lift, where I'll add that component in. And what's happening there is I'm sculpting the submandibular glands, the digastric muscles, the deep fat plane, that allows me a much better result. That's to help with a bulky neck, because they've shown that these glands fall over time and they really need to be trimmed to be able to get a cleaner jaw and neckline result. And there are times that I'm doing an isolated deep neck lift, and that's really for a younger individual, like a 20 or 30-year-old that doesn't really have any sag, but they just have a very bulky neck and they want that addressed in isolation. Now, they have a lot of sun damage and there's a lot of jowling. They're going to have to do a combination procedure with a deep plane facelift and a deep neck lift. But if they just have a bulky neck and they're very young with elastic tissues, I can do an isolated deep neck lift with just an incision underneath the chin to bring that neck back up. So this is the final component of the three-part general series, although I've done a lot of mini parts to these series to talk about this. I encourage you to go and look at my other videos on this subject to dive deeper into this matter, because this short 3.5-minute video obviously cannot cover everything. These are just meant to give you a cursory overview of the general philosophical perspectives I have toward the aging phase.